Hi, this is Dr. Tasan, one of the partners here at Southern Mississippi Heart Center. I wanted to talk about a disease process called atrial fibrillation. This is a very common diagnosis in the cardiology world, where it is an abnormal heart rhythm that generates from the top chambers of the heart, which can cause your heart rate to go very fast and for a significant amount of patients also require a blood thinner. There is a technology that is out there, or a medical device, that allows you to live your life having atrial fibrillation without the need for a blood thinner. Not everybody meets criteria for this device. However, I just wanted to give a little education about what the device looks like and if it would be appropriate for a certain subset of patients. This is called the Watchman device. It's basically a little plug that is implanted inside an area of the heart called the left atrial appendage. This is where the blood clots are formed that can cause a significant amount of hospitalizations due to stroke, or sometimes even blockages in the legs or different arteries that go to the organ. This device is a very good option for people who have a very difficult time affording medication, people that are prone to fall, and people that are high risk for bleeds. What is the effectiveness rate of a Watchman implant? At 45 days, we have data that shows that it is 97% effective and 100% effective at 12 months. Its complication rate is less than 1%. Basically, after the implant of one of these devices, the patient is able to come off blood thinners instantaneously and go on lower risk medications such as aspirin and Plavix taken at the same time. They come back in at a later date, usually around 45 days, and we make sure that there is no leak around the device and it's sealed off well. And from that point, the patient simply comes off their Plavix at the 6-month anniversary of implant and lives the rest of their life on a baby aspirin. Just because you have atrial fibrillation does not mean you need a Watchman device. This device is specifically geared for or tailored for patients who have a high risk profile to have a stroke if they are not able to be on a blood thinner continuously due to some of the topics we discussed before. Those risk factors include the gender of the patient, the age of the patient, a diagnosis of heart failure, diabetes, a previous diagnosis of stroke, or underlying vascular disease such as a history of a previous myocardial infarction, commonly known as a heart attack, or peripheral vascular disease. If you feel this would be something that is applicable to you, or you have a desire to come off blood thinners for reasons that affect your activities of daily living, inhibit your ability to live a normal life, or any of the other risk factors that we discussed before, feel free to contact us, and we're happy to speak with you and see that you'd be a good candidate for this device.